AASLD Secretary Dr. Kimberly Brown is here now talking about the AASLD program here at DDW. Thank you for being here.
Thank you for the invitation.
Boy, a wide range of topics over several days. Can you discuss some of those, please?
Yeah, I think it's an exciting time in hepatology as we are trying to move a little bit away from hepatitis C and into some other areas of focus. Saturday starts off with just an excellent program, Hepatology in Review, which I think is a really nice overview of the year in hepatology for the practicing clinician or our fellows. When we move into Sunday, there are several clinical symposium that really highlight some of those new areas that we've always studied in hepatology, but really now moving toward more exciting therapies. The first really starts out with hepatitis B. So as you know, with hepatitis C, we've moved toward a cure, and we cure the majority of patients with hepatitis C. But with hepatitis B, we've really controlled or managed the disease with the therapies that we currently have. Dr. Liang is going to highlight some of the newer concepts in terms of how we eventually get to a cure of hepatitis B. And I think his lecture will be very exciting for people to go to. The next symposium really focuses on fatty liver disease, or NASH. You know, there are millions of people in the United States who are affected with this disease, and Dr. Rinelli will try to help the audience understand how we identify those patients. And Dr. Lumba will really review some of the new targets for therapy and some of the advances we're starting to make in the area of NASH. And then finally, Dr. Friedman, really, who's outstanding in the area of fibrosis, will really be able to cover some of the newer concepts, the targets about how do we treat patients with any form of liver disease where the result is really fibrosis or damage. On Monday, we kind of move into a lot of hepatitis C. There's still some new things that people will want to hear about. One of the highlights, I think, will be Paul Pockros. He'll be talking about sort of the therapies that are moving into 2017. And then finally on Tuesday, Dr. Talwalker is really going to have a very nice lecture, I think, on how we approach and manage chronic liver disease in the setting of the Affordable Care Act.
One of the things that I know you mentioned several times in that answer was the word cure. And
yes.
In medicine, that is rare, yet it's been such an exciting time in the care of people with liver disease that we're not just talking about managing it, but really offering people a meaningful cure.
Exactly. And I think that's really an important concept. You know, when we think about many diseases that we care for, we don't cure hypertension, we don't cure diabetes, we don't cure hyperlipidemia. We manage or control those. With hepatitis C, I think we've come to recognize that when you cure an underlying disease, the liver responds in a very favorable way. And as such, that's really been the goal now of research, is going after targets that not just control damage or disease, but really cure it, or in the case of fibrosis, really reverse it.
And meetings like this, I think, do so much for that, bringing so many disciplines together here at DDW, so you can discuss the research and discuss the future, and look what happens.
Exactly.
And so what do you hope attendees gain this year?
Well, I like DDW because it's really an area where all of us who train in this field come together as one. We all have our special little niche fields, but this is really where we can see where the entire field is moving and going. And as part of that, there are a number of practitioners who might care for liver disease is only a part of their practice. And this is an excellent setting for them to be updated on the new advances that they can offer their patients and the new directions that we're taking in research in the area of liver disease.
Exciting times. Dr. Brown, thank you so much.
Thank you.